There's no doubt about it. Losing your hair is incredibly personal, and it can be devastating to your self-esteem. For our discussion today, Nataliia and I want to dive deeply into the subject of thyroid-related hair loss, how it comes about, what you can do to help it get better. So stay tuned until the end because we'll talk about the best supplements for your hair growth.
Hello, thank you for listening to Thyroid Hair Loss Connection podcast, a science-based, honest, candid conversation about how your thyroid affects your hair. You will learn practical solutions to hair growth, healing your thyroid, and balancing hormones with holistic nutrition approach and the latest treatments. Your hosts, me, Nataliia Sanzo, a registered dietitian, aka Nashville thyroid expert, and Kimberly Vaughn, a board-certified trichologist, hair loss specialist, and coach. To stay up to date on the latest topics, make sure to subscribe to our channel. We also cannot do this without you. Send us a question to the link below and tune in each week for the answers. Now, let's head to the show. Hello, listeners. I hope you're having a great day. Kimberly and I have a very informative episode prepared for you today. So let's jump into it. Without a doubt, there is a very strong link between thyroid function and your hair growth. The first thing I want to note is that hair loss is a symptom, not a diagnosis. For example, a high fever is a symptom of meningitis, right? Well, you get the idea. So with this in mind, let's talk about thyroid-related hair loss. As you guessed it, hair loss is a symptom of something going wrong in your body. An estimated 20 million Americans have some sort of a form of thyroid disease. Can you believe that up to 60% of those with thyroid disease are unaware of their conditions? That's just crazy, right? Now, remember that there are different kinds of thyroid disorders. The most common is hypothyroidism or low thyroid. In 90% of those people with hypothyroidism, the hypothyroidism is caused by Hashimoto's, which is an autoimmune thyroid disease, in which the immune system stops recognizing the thyroid as part of the body and begin attacking it. This causes the thyroid gland to become inflamed, which is known as thyroiditis. Other names for Hashimoto's thyroiditis include Hashimoto disease, chronic lymphocytic thyroiditis, and autoimmune thyroiditis. And you can imagine as Hashimoto's ravages your thyroid gland, destroying it from the inside out, your thyroid gland will eventually have problems producing enough thyroid hormone. The result? Well, you'll start to experience the symptoms of hypothyroidism. And these symptoms include dry and brittle nails and hair, hair loss, reduced hair growth, hair breakage, excessive hair loss while showering. And we know that our thyroid plays a crucial role in both the development and maintenance of hair follicles. That means that low thyroid function can make your hair fall out and can slow down or completely actually stop hair regrowth. Now, Kimberly, it's interesting how thyroid-related hair loss and hair changes, they do have characteristic patterns. For example, diffuse hair loss and thinning across the whole scalp, right? Hair loss that occurs in discrete areas of the scalp, like resulting in a smooth and circular bald patches. Loss of body hair from areas other than your head. And it's interesting that a unique and characteristic symptom of hypothyroidism is the loss of hair on the outer edges of your eyebrows. And I know we talked about it a little bit. Changes, and of course, changes in your hair texture. With hypothyroidism, your hair may become dry and just coarse. But with hyper or fast thyroid, it can become extra soft and fine.
That's exactly right. When the thyroid gland is functioning correctly, hair follicles can regenerate themselves, going through the phases of growth, regression, and shedding, and then, of course, growing again. Once your hair has reached its peak, hair follicles begin the resting and the shedding stage, known as AKA telogen effluvium. This kind of shedding is totally normal when it is progressing in a normal life cycle. However, for Hashimoto's patients and those suffering from other thyroid conditions, this hair loss period may express itself in a much more aggressive and dramatic phase of hair loss. And this is also a phase and a symptom, if you will, of increased stress, also imbalanced diet, crash diets, or an overactive thyroid. So, Nataliia, how exactly does an imbalance in the thyroid hormone lead us to hair loss? I mean, I know that's what we're talking about here, right? But concretely, I mean, give us a little bit more in the detail field so that we can dive into this.
Well, Kimberly, thank you for asking. The nerd in me kind of got excited because I love talking about why and how things happen. So according to a review that was published in Molecular Biology of the Cell, thyroid disorders caused by disrupted T3 and T4 hormones can cause hair loss, especially in untreated or extreme conditions. So let's remember that T4 and T3 are the main hormones produced by your thyroid gland, right? Thyroxine or T4 hormone. And let me note that here we're talking about free T4, not the bound one. And we actually dedicated the whole episode talking about what our thyroid hormones test results mean. So make sure you listen to that. And so the T4 hormone is responsible for your metabolism, mood, body temperature, just to name a few. Now, T3, too, is made in the thyroid gland, but it can also be made in other tissues within the body by converting T4 into T3. So this hormone is at the center of your digestive and metabolic function, and it also oversees bone health. So think about the fact that we have trillions of cells, and each of those cells have thyroid hormone receptors. When we have too much or too little thyroid hormone, every cell is affected, leading to imbalance in the whole body. So generally speaking, too much or too little thyroid hormone can result in hair loss.
Wow. I always get totally tongue-tied and confused with a hypo and hyper, but you're doing an amazing job explaining it to us. So now let me see if I have this right. Most people with hypo or hyperthyroidism have an autoimmune condition, right? Or a disease. We've established that, correct?
Yes. It's safe to assume, yes.
Okay. So if a person has one autoimmune disease, such as hyper or hypothyroidism, he or she is also very likely or might already have another form of an autoimmune condition. Mm-hmm. So hence, this leads right into alopecia areata, which certainly is an autoimmune condition with the balding in the small circular patchy areas of the scalp. And as we had mentioned before, we're certainly going to cover this in an entire episode because right now there's so much new data. There's so many new clinical trials that are surfacing, and there's just a lot of information. So we could probably take a full or 2 episodes to go over this. But with that being an autoimmune condition and it certainly progressing and moving to other autoimmune conditions, then this occurs in people with this thyroid disease more often than expected by chance, right? So is there some correlation here?
Absolutely, Kimberly. That's just like you said, having one autoimmune disorder also increases your risk of having others, including alopecia areata and celiac disease, which they both can lead to hair loss. I believe it was a report done in 2020 that was published in the Journal of Nutrition Medicine and Diet Care they highlighted that hair loss caused by alopecia areata has been shown to improve, listen up, on an anti-inflammatory diet rich in probiotics. So, yes, very interesting and very important. So, yes, we know that we have to, alopecia areata is an autoimmune disease and we have to treat it. You guys provide incredible treatments in the office, but man, the diet is so important. They actually did study on it.
Yes, yes. The holistic health in and around hair loss and hair growth never gets enough attention. And that is one of our goals and our missions at HPI Hair Partners, is to make sure that we really focus on that.
Absolutely, absolutely. And there was actually another report done at Beyond Celiac, which is a research foundation in Pennsylvania. Hair loss caused by celiac disease, right, improves on the gluten-free and iron-rich diet. Now, I'm going to put it all together for you. Now, our listeners have to pay attention right now, since there is a strong association between Hashimoto's, alopecia areata, and celiac disease. Here's the bottom line. A gluten-free, probiotic, enhanced, and iron-rich diet may help promote hair growth in some Hashimoto patients. So it's like a full circle. That's where we're making the connection.
Well, and also, as we think about celiac disease or any type of gut disease, right? Whether it's a diagnosis, whether it's an irritability, there is a problem with the breakdown of the nutrients in the body because they're not truly penetrating into the bloodstream. They're getting caught up in the sludge in our gut and in our gallbladder, right? So that's going to cause a problem across all lines of our health.
Absolutely, Kimberly. And I think we need to talk about it in these episodes. But before we jump talking about nutrition deficiencies and all that stuff, I want to mention something. Another important concept that we need to keep in mind is that hair loss is what we call a slow indicator, right? And I think you can agree. That means that it is slow. It's a slow symptom for you to notice, and it also a slow process to reverse it. So we need to be patient, right? So when your thyroid hormones shift in some way, low or high, will cause a hair loss. And it typically means it is based on something that happened in the past 3 to 12 months and not 3 to 12 days. I think that's what people are missing. This means that when you identify and start to treat this problem, you can start to see hair loss stop or slow down in any meaningful way in 1 to 3 months. And that's actually what I experienced with you when I came and did treatments on my scalp. I saw that my hair loss stopped within about a month. But we have to remember that it actually started 3 to 12 months prior.
Oh, yes, for sure. Now, I don't know. I'm going to jump in here, and I might be off script, but I'm going to ask you a couple of questions so that the listener understands. When you started having thyroid issues, and remind me, I think you had said that your hair loss started, you had gained some weight, you were having some trouble with temperature balance, right, in your body?
Yes. Those symptoms actually never go away. The cold sensitivity, the weight, the ups and downs, but the hair loss, that was something new that I haven't experienced in 4 years since my diagnosis.
Okay. And when we started treatment, we certainly started treatment on you, a dietitian. So yes, we did perform our hair follicle testing that talked about proper foods to restrict, proper foods to include. Also, if the body is having a hard time absorbing those foods, then we can add in some additional supplements to help kind of kickstart and get that sprint going to get our hair growth back, right? But in addition to that, what we did is we performed a lot of topical treatments on you specifically Typically, when we have a client come in and we're trying to really understand the root cause and what other health issues might be underlying causing this hair loss, we start right away digging deeply and looking at the thyroid and the hormones, and then certainly add along those clinical lab blood tests that we've talked about, as well as what's important is then the hair follicle test, bringing it all together so that someone that is not educated as yourself and a registered dietitian truly understands the importance of how to balance topical treatments for scalp and for hair loss and hair growth, how to slow the loss down, right, as quickly as possible, but then also how to maintain the body and build the body from internally.
Absolutely. Absolutely. It's so important to properly combine the topical treatments and what you put in your body. And it will lead me to talking about nutrition for hair loss. So, to make things worse, low thyroid function may lead to nutrient deficiencies that are required for proper hair growth. So we're going to talk about it more, how this happens and how to replace these nutrients. So by virtue of how thyroid hormone reduces stomach acid, it can also reduce the absorption of nutrients like iron and B12, which are required for proper hair growth. And Kimberly, you mentioned at the beginning of this episode that the absorption of the nutrients is diminished with somebody who have hypothyroidism. So honestly, in my practice, I see that iron deficiency is the primary cause of hair loss in premenopausal women and is often the reason why women with Hashimoto's continue to lose hair despite taking thyroid medication. And, to complicate things even further, thyroid hormone medications like levothyroxine, and that's synthetic T4 hormone, that's what I'm taking. That medication can cause hair loss as a negative side effect of just taking that medication. So effectively, you may be losing hair because your thyroid function is too low, but taking thyroid medication also might be increasing your hair loss. So that's why you have to address it with the doctor to make sure that you're on the right kind of medication. And don't forget that hypothyroidism itself also depletes micronutrients required for proper hair growth. So when we put it all together, all these factors, it's easy to see why finding the root cause of your hair loss can be difficult and why it takes a comprehensive approach and a team of experts like Kimberly and I, to get to the root cause of your hair loss. So to kind of summarize what I just said, that hair loss can happen from hypothyroidism itself, right? The nutrient deficiencies, as a negative side effect of thyroid medication, or from the nutrient deficiencies that are caused by low thyroid hormone. So we have to address all of these aspects to ensure proper hair growth.
Nataliia, so stomach acid, celiac, boy, oh boy, we're doing this circle again back to the gut, right? So if low iron and improper balance of B12 is causing more irritation in the stomach, my gosh, what else do we need to know? What other supplements or nutrients should we be considering regarding tackling this thyroid and hair loss connection?
Absolutely, yes. There are more to hair loss than checking your iron and B12. It is helpful to consider some micronutrients that may be contributing to your hair loss, right? Here's a couple that I want to be mindful of. Besides iron, best studied ones are zinc and biotin. Of course, there are others, but I'm very science oriented, so unless I have a very hard, science backing me up, I don't want to talk about it. So let's touch on zinc and biotin. Zinc seems to be the most relevant actually for all types of hair loss. Not only did studies surrounding zinc show that those suffering from hair loss were low in serum zinc, but zinc supplementation did improve symptoms. That's an important thing because it shows that zinc is something that is useful when it is supplemented correctly.
Whoa, I have to jump in here. That's perfect. So you're exactly right. And what we need to also recommend to our listeners is, the recommended dietary allowance, or the RDA for adults 19 years and older, is 11 milligrams a day for men and 8 milligrams a day for women. So just as sensitive as the thyroid medications are, treating hyper and hypo, same exact principle with zinc. Because if zinc is taken in too high of doses, it can cause hair loss. So that fine balance is really, really important. And I want everyone to really pay attention to this because with the pandemic, there were several nutrients, micronutrients that, boy, you couldn't get enough of in your chewing gum, in your lozenges. Every place that you looked, there was zinc, there was vitamin D, there was something else, right? So I want you to be careful and cautious as you examine your zinc levels. I also want you to make sure that if you are supplementing, right, with zinc in an actual pill form or a liquid form, that you're not overdoing it. And certainly the best way to determine that is with a lab check.
Absolutely. Blood work does not lie. That's why if you hear somebody's recommending, a life coach recommending you a list of supplements, run away unless they run a full blood work on you. Kimberly, let me elaborate a little bit about supplements. And I want to kind of give our listeners a list of best supplements for hair growth. So you mentioned zinc. Zinc is required for, of course, hair growth. And thyroid hormone is required for zinc absorption. That's why hypothyroidism and hair loss kind of go hand in hand. And also zinc also improves T4 to T3 conversion. So important. Of course, selenium. Selenium helps boost T4 to T3 conversion and may actually reduce inflammation in Hashimoto patients. It also involves in hair synthesis. Of course, we know that. And I thought there was a study done that they combined biotin, silica, and choline. I'm not sure how to say that. But supplementing with biotin in double-blind trials show an increase in the number of hair follicles and hair volume and hair thickness. I think it sounds like a great cocktail to take every day.
That's right. Yes. And those, oh boy, the best way to explain this, I think, is the actual combination approach of supplementation is the key for hair growth. And we have to be careful. I mean, there are a lot of studies, there are a lot of clinical trials that are going on right now, and especially, oh my gosh, they've duplicated and triplicated, if you can, after COVID, certainly. But we just need to be aware of which supplements work together properly and which ones don't. And I think you were leading into that.
Yes, absolutely. The last two I want to mention is L-lysine. That it showed that addition to iron can improve hair growth, and also vitamin B12. And you can buy them in shots, which is, I think, very convenient. Now, vitamin B12, along with normal hemoglobin, is required for optimal hair growth. And in my practice and studies shows that hypothyroid patients are also at increased risk for developing B12 deficiency. Now, we know how important it is to take everything as the whole body approach, right? And you can find all of these supplements in hair, nails, skin supplements. You can take them individually or as a complex. You do have to remember that not all supplements are created equal. look for high quality supplements and preferably with organic ingredients. And if you want to know exactly what brand names I recommend, you can visit my website at www.allpurposenutrition.com/shop. But Kimberly, I know you have a very strong opinion on a few supplements and why not all supplements are created equal.
Very, very true. And the world of supplementation is very complex. And, we just take it very, very seriously at HPI Hair Partners. And the reason that we do is because many times clients come to us with a list of, it can be range anywhere from 5 supplements to 15 that they're trying to ingest in their diet on a daily basis. And yes, back to your list with iron and B12, selenium, biotin, and zinc, those are all very important. But what we also need to kind of call out is when you mention lysine. So lysine is an amino acid. And truly, there are 20 amino acids. Part amino acids are essential. The other parts are non-essential. And again, for another episode on which is which, but what we want to make sure of is that people understand that if there are 9 amino acids that are not trending and functioning properly within this string of aminos, we can see hair loss as a side effect. We can see breakage in the hair shaft. We can see brittle hair. We can see drying hair. And more importantly, you can see a tender, sore scalp. And that's really important. So our key is making sure that we try to keep the supplementation and the actual food recommendations and the food restrictions as simply as put as possible. And there's a lot going on when a client comes to us. And certainly if their thyroid is a problem and they know that going into it, it certainly helps us to get started. Because if they're on proper medication, then we know that that's covered. Now what we need to do is slow that telogen effluvium down, make a difference in what's going on in the interior of the hair follicle. And many times, if we're unsure the nature and the cause, we will certainly perform a biopsy on the scalp. And we like to make sure that that biopsy is performed in 3 different areas on the scalp because the trends in pattern thinning, whether it's with an autoimmune condition or a genetic condition, can be very different depending upon the scalp. So back to those supplements, right? We have seen some very strong data just recently in the last few years on vitamin D, which again, that was highly discussed and talked about during COVID. The other nutrient is also copper. So let's talk about the importance of copper being a mineral. So our body's made up of minerals. Our body's made up of these amino acids that we talked about, and certainly vitamins that lead through our system to help and keep us stronger. The number one thing that I love to talk about with copper is that it's the science is so new that the FDA in the United States, or the RDA, I should call it, right, for the Food Drug Administration, doesn't even provide us with an approximate level of where that copper level and that mineral level should be to date. However, our friends across the border, the Canadians, do offer their version of the recommendation, and their allowance amounts are ranging for adult men 1.5 to 2.5 milligrams per day. However, adult females are closer to 2 to 3 milligrams a day of copper. And so copper is also challenging for individuals to absorb enough nutrients through foods. And sadly, we see there's a little bit of a socioeconomical issue when it comes to getting enough copper as your dietary supplement. One of the main areas where you'll see this copper is in organ meats. So let's see, Nataliia, when was the last time you had liver for dinner?
Great question, because I eat organ meats all the time, so I'm a terrible example.
That's okay. Well, see, that's good. And then we look at seafood, beans, nuts, and whole grains for copper. Many people do not get enough of these items into their diet. Now, your heritage is slightly different, and so your emphasis on organ meats probably is different, in addition to certainly how much you know about the diet, right? Yeah. So I encourage all of our listeners to go jump in and get your organ meat dinner prepared today. But the other thing is that signs of copper deficiency include anemia, low body temperature, ding, 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 bone fractures, osteoporosis, and thyroid problems. So when we look at the importance of copper, it's on the top of our hair growth list. And so I want everybody to really focus on that particular mineral. The next area that we focus on, in addition to the zinc, is the benefits of vitamin D. RDA recommends that individuals 19 years or older have at least 600 IU daily for men. And for women, we like to see more around 800 IU. When we start getting a little older in those aging, lovely senior adults, the levels of vitamin D even go higher. Now, I think it's safe to say that most of us listeners, as well, certainly as you and I, Nataliia, understand that you can gain tremendous amounts of vitamin D when you live in a sunny, warm climate and you're outside more frequently, right?
Good luck with that.
Yeah. Mm-hmm. What does the dermatologist tell us not to do?
Well, not to sunbathe without your sunscreen on.
That's
and guess
right.
what we're not getting while we're using sunscreen is the vitamin D.
That's exactly right. So hence, we really focus on these areas that it's hard for the client and the patient to really understand the importance and how you can receive benefits from vitamin D, from copper, from selenium and zinc. And certainly we have an episode that's planned that will talk about the foods and how important it is to increase certain foods in your diet that will help naturally increase these levels in your system.
Absolutely. Yes. Most people don't get all these essential vitamins and minerals from their diet just because our diet is, we call it Western diet. So it's poor quality protein. It's lab-made micronutrients and vitamins that we take in the pill. They cannot be substituted for real food. So everything you said are excellent points, and it all goes back to the concept of treating hair loss from the inside out. Now, to finish everything up, I know you guys, I hope you guys learned a lot today. I sure did, especially about copper. That was never on my radar. And if you guys are interested in the studies that we used to prepare for this episode, Kimberly and I will make sure that we link them in our podcast notes below. And just final words. The earlier you address the symptoms of hair loss, the more likely you are to avoid irreversible damage. Get the answers you need to start treatment today. Kimberly's and mine contact information in the show notes. So thank you guys for listening, and we will talk to you soon.